Hi, my name is Stu Woolleyand, Paramedic Practice Leader with British Columbia Emergency Health Services, and welcome to the January 2023 Clinical Governance and Professional Practice update for you today. I'd like to start the video by acknowledging that today I'm joining you from the traditional and unceded territory of the Stolos and Seaward Islands people in Agassiz in southern British Columbia. I'd like to start today's video by discussing the decriminalization of personal carry substances with patients that we're going to encounter in the community. Beginning January 31st, 2023 and through to January 31st, 2026, the personal possession of small amounts of illicit substances will be decriminalised in British Columbia. Personal possessions up to a cumulative amount of 2.5 grams of opioids, cocaine, MDMA or methamphetamine are included in this exemption for adults over the age of 18. And during this period, there'll be no charges made and no arrests made to people who are found to have less than 2.5 grams of these substances for personal use. To support this, police colleagues will be offering resource cards to individuals, which will include support services within the community. As a result of this legislation and decriminalisation change, the BCEHS Personal Property Standard Operating Procedure will be amended to allow patients to carry up to 2.5 grams of the substances as their personal property. These drugs will no longer be confiscated. Instead, they'll be treated like any other patient belonging and given back to the patient by the police. Please do keep an eye on your email and further ops updates for when this standard operating procedure is going to be updated. I am really excited to announce that following several years of research, medication trials, data collection, and feedback from paramedics via the PSLS system, we are now in a position to expand the pain management scope of practice for all clinical licenses within BCEHS. Once training has been completed, EMRs will have the addition of acetaminophen, Tylenol, ibuprofen, Advil, and methoxyflurane, Penthrox, into their scope of practice within BCEHS. PCPs, ACPs, and critical care paramedic colleagues will have the addition of Penthrox added to their scope. We are continuing to research additional pain management strategies within BCEHS, which is including intravenous acetaminophen and opioids for PCPs, ACPs, and CCPs. More information is going to be coming as we continue the research into these additional expansions as part of the scope expansion project. So do please keep an eye on further updates. To begin the rollout of Penthrox, there is going to be a comprehensive pain management fundamentals course, which will be required for all practice levels prior to the scope increase. This is going to be a phased rollout, with the focus being on rural and remote communities in the first instance. Station supervisors at select stations will be completing the initial training, and then they're going to be helping facilitate the hands-on training for every member of staff at their station with the Penthrox inhaler training devices. Paramedics will then be permitted to administer the medication to patients once both the Learning Hub course and the hands-on training has been completed and the medication is available at stations. We anticipate the training to begin January 2023, with the goal to have all members trained and medication at stations by February 2023. So do please keep an eye on local announcements for your stations to get this up and running for us. This is a really exciting time and some good changes within BC for our patients, and I know it's one that we've been asking for a long time. Into the BCEHS research category for us today, the Frontier trial, which has been ongoing for 7 years, is now coming to an end. The final patient is going to be enrolled in the Frontier trial on March the 15th, 2023, at which point all of the materials, drugs, equipment, and fridges are going to be removed from service. So a massive thank you to all of the paramedics that have supported the Frontier trial throughout BC. We've enrolled up to 600 patients across 3 sites in British Columbia, and your contributions and assessment and involvement in the trial is really helping us to advance stroke care within the communities, and we're really excited to see the results of the trial. Although one trial is ending, there is another trial beginning. So please do keep an eye on further messaging regarding the EPI-dose trial, epinephrine dose optimal versus standard evaluation. This is going to be coming out in the new year for ACPs regarding the epinephrine administration in pre-hospital cardiac arrests. And we're looking at the effectiveness of low cumulative dose of epinephrine compared to the standard cumulative dose of epinephrine that we currently give. So please do keep an eye out for more information in future practice updates for involvement and enrollment into the EPI-dose. You will have already noticed that there's been some changes to Siren in preparation for this. So as soon as we have more information, this will be coming out to you. Within the Fraser Valley, we've had 3 specific practice updates, which have all gone live over the Christmas period and now updated in the BCEHS handbook. The first one being stroke clinical pathway update for patients within the Delta region. Patients in Delta who meet the BCEHS stroke clinical pathway will now bypass Delta Hospital. These patients should be transported to Vancouver General Hospital as the nearest emergency department. For patients who are north of Highway 99 in the more rural communities and the industrial areas, you may find that the Royal Columbian is your closest emergency department, and it's still acceptable and appropriate to convey to your nearest emergency department. We're just bypassing Delta Hospital for patients who meet the criteria. There has been some updates to the trauma pathway for the Fraser East region, so patients east of 264th Street. Please do refresh yourself on the trauma guidelines. Step 1 and step 2, physiological and anatomical criteria. Transportation is still to the Royal Columbian if it's less than 60 minutes, although steps 3 and 4, mechanism and special considerations respectively. We're now going to consider transport to Abbotsford Regional Hospital, where these patients can get appropriate trauma care in the Abbotsford area. And the final clinical update for the Fraser region is a change to the forensic nursing services. Previously, patients who was victims of sexual assaults would have to be transported to a specialist centre, whereas now these patients can be taken and cared for at the nearest emergency department, where first and foremost they're going to get the appropriate care and support they need, and then access to a forensic nursing service for them can be made at any emergency department within the Fraser Valley region. So for these patients, please do now take them to the nearest emergency department where they get the support that they need. And finishing this practice update for you for January is just 2 congratulations. A massive congratulations to Tyson Lemon and Justin Cravance on their first publication in the Journal of Emergency Medical Services. It's a great achievement to be published. It recognises the work and the research that you've done and how it helps deliver pre-hospital care and how we're shaping the future of emergency medical services. And it's recognised through everybody that can see the publication. There's a link within the PDF version of the Ops update, and you can find access to the publication there for you. And also congratulations to paramedic practice leader Jen Bolster for her first author publication, looking at the emerging concepts of paramedicine literature to inform the revision of Pan-Canadian competency framework for paramedics. Jen's work can be viewed within the Ops update as well. So many congratulations to all 3 of you for the continued work and dedication that you're doing to shape the practice within BC. That wraps up the Ops update for January 2023. Thank you for your time today. Happy New Year to everybody, and hope you managed to get some downtime and some rest and recharge over the festive period. And to the crews that was working, thank you very much for all your support. I know the weather hit us. We was continually busy, so we're continually grateful for the support and care that you're providing to patients all throughout British Columbia, whether it's in Metro or in the rural remote communities. Thank you very much. Take care.